Good afternoon, everyone. Thank you for joining us this afternoon for our COVID-19 Oncology Patient Support Task Force webinar. Just as a way of introduction, the COVID-19 Oncology Patient Support Task Force is made up of about 13 Canadian patient advocacy organizations and is a special project under the umbrella of AllCan. AllCan is an international multi-stakeholder policy initiative that aims to identify ways to optimize the use of resources in cancer care by focusing on outcomes that matter the most to patients and thereby creating greater efficiency in cancer care. Save Your Skin Foundation, the organization with whom our presenter today, Louise Binder, is a health policy consultant, is a member of the AllCan International Steering Committee and was established as AllCan Canada's Secretariat to lead the initiative in Canada. Although this is not a neuroendocrine specific subject, the impact of COVID-19 on oncology patient care is top of mind for our community as well, as many others. And Louise Binder has joined us today to address the many questions and concerns Canadian cancer patients have during this challenging time. So Louise Binder is a lawyer and a health advocate who has been involved in informing the development of health policy and systemic treatment access practices from the patient perspective since the early 1990s, subsequent to her own HIV diagnosis. She co-founded the Canadian Treatment Action Council in 1996. Louise began similar work in the cancer area and is presently, as I mentioned, a health policy consultant with Save Your Skin Foundation. She has been recognized by many organizations for her work, including receiving an honorary doctorate of laws from her alma mater, Queen's Law School, and the Order of Ontario from the province of Ontario, and 2 Queen Elizabeth II medals. Louise, thank you so much for joining us today.
Thank you very much for that kind introduction, and welcome to all of you, and thank you for joining today. I know this is a very strange time, to say the least, for all of us. It's actually the second pandemic in which I have been very directly involved, and that is too many for me, but there we are. So I'd like to start just by saying a little bit about AllCan Canada, just to contextualize why that's the organization that's the umbrella organization under which we're doing this task force work. And then I'm going to describe the task force to you and how we're planning to move ahead, and certainly answer any questions I can for you, and also I would love your feedback on how you think we should move forward with this task force, because we're just in our beginning stages. So to start, AllCan, it's an organization that actually started in Europe. It's an international organization, and it was set up by European cancer groups to look at waste and inefficiency in the cancer care system. And they started out by doing a survey in Europe of what patients thought to be very wasteful and inefficient areas in cancer care, and then started to think about how they would do their work. So Kathy Bernard, who's the founder and president of Save Your Skin Foundation, was a member of AllCan, and she decided that it would be good for us to have a chapter in Canada. So that's how AllCan Canada started. The steering committee for the organization is multi-stakeholder. So there's representation from government, there's representation from the pharmaceutical industry, there's representation from the medical community, as well, of course, as patient groups. And the steering committee had a meeting and decided that the first issue that they would tackle in terms of waste and inefficiencies was time to diagnosis. And so the organization is starting out by doing an environmental scan across Canada and elsewhere about best practices and problems in time to diagnosis. So that work started, and then tragically, this pandemic hit. And I guess we can go to the next slide and have a little look at the context in which we decided to set up this task force. So we were getting phone calls both at Save Your Skin Foundation and many of the other patient cancer organizations, and pharmaceutical companies were getting calls, governments were getting calls, talking about all the issues that patients were experiencing as oncology patients as a result of COVID-19. So patients were calling up saying that their regular appointments were being canceled, their diagnostic tests were being canceled or delayed, treatment and care was being canceled or delayed. And the first call we got was from a woman at Save Your Skin, was from a woman in Vancouver who was supposed to get cancer treatment in Toronto, and the hospital in Toronto said that they would certainly see her and treat her from Vancouver as long as she only came to Toronto by private car, which you can imagine was completely impractical. And that was kind of the first warning to us, and that was about 6 to 8 weeks ago, that we were in for some very difficult practical problems for oncology patients during this pandemic. Of course, in addition to the practical problems, this was creating profound mental health problems for people. Having a cancer diagnosis in and of itself is profoundly stressful, and in addition, there were now new anxieties, depression, and other issues that were arising for people because of these delays and cancellations. And third was this overarching feeling of having to manage both these practical issues and their mental health concerns in isolation, because of course people are not permitted to be in large numbers, and in fact many people are in isolation or self-isolation, and this of course adds to this feeling of desperation and having to manage all these practical and anxiety problems alone. So it became clear also that with more senior populations, people living alone, people who didn't drive, people who are on lower set incomes, or of course who have underlying comorbidities or mental and physical challenges, all these other issues were even more difficult. And so there was a real concern, in addition to all of that, about going out even to a grocery store because of fear of infection. So this was just a profoundly overwhelming problem for many, many oncology patients, and we were getting many calls about all of these issues, some or all of these issues. So based on some experience that I had in organizing during the HIV pandemic, and based on previous experience that we'd had generally helping oncology patients one-on-one and in support group projects, we decided that we would set up what we called a COVID-19 oncology patient task force. And if you look at the next slide, you'll see that our vision was to help oncology patients across the continuum of emotional supports and practical supports, and also to get out of this terrible sense of isolation that everybody was feeling, and they were particularly feeling as a result of these other issues that they were having to deal with. To the extent, of course, that it was feasible for us to do so in a state of emergency, which we are, and also with limited resources. We had no idea what resources we might have available to us to do this, but we decided we would at least take it on and do the best that we could. So if you look at the next slide, you'll see that the way we decided to tackle 3 things, and we set out working groups to work on them. So the first thing we decided was that we needed to ensure that all oncology patients had up-to-date information and also could provide us with up-to-date information that they were getting, and that we could do knowledge translation. So in other words, if there was information coming out from the government that was complex and needed to be brought down to a level that we can all understand it, that we would do that. And so that, because we were getting a lot of questions about COVID-19 generally, and of course, more specifically about that in relation to cancer, cancer diagnosis and practical matters for cancer patients. So we decided we wanted to make sure there was a hub where information was being shared and exchanged. The second clear need was mental wellness support. And we know that in oncology, as in every area of mental health supports, our system has never been sufficient, has never been it hasn't dealt with this issue with enough resources. And so we thought if there was some way that we could help during this time, we would do so. We weren't sure quite what it would look like, but we would try. And certainly, last but not least, were simple practical supports and solutions to those practical supports, like this woman calling us and saying, what am I going to do? How am I going to get to Toronto? Can we do something else? And those really practical living issues. So those were the 3 areas that we decided to tackle. And we got together. If you look at the next slide, the first thing, as I said, was this question of information exchange and knowledge translation. So we got together with and we talked to a number of other oncology groups other than Save Your Skin. We found out what they were doing in terms of surveying patients, and many of them were and still are, to find out what information they needed, what questions they had, and how we could assist them. And we put together all of that information, and we decided that we would try to develop a single repository for all the questions and answers that we could, or links to places where people could get their questions answered. So that was the first idea with the knowledge exchange and translation. So for instance, today, perhaps you heard that the Federal Minister of Health has set up a mental wellness website where people can get information about mental wellness. So our information exchange and knowledge translation hub would have a link to that place on the Health Canada website where people could go for that. And every bit of information that we can get that we know is reasonable and has been validated, we will put up there. So that's the first thing. So people just know what's around for them, what's available for them, and what we know up to date about this pandemic and the implications for oncology patients. So if we go to the next slide, you'll see that the second issue is mental wellness. And here, of course, we absolutely knew that we needed support from mental health experts in order to develop any kind of a hub to help people with additional supports during this difficult time. So we brought together a group of both oncology patient group representatives as well as mental health representatives, both institutional and a private sector. And we discussed the feasibility of somehow connecting people with existing professional supports that were out there in the community that might be able to take on a little bit more during this period, as well as any group activities that were going to be done by webinar, and there have been some, and additional support such as coping skills, meditation classes, anything that might help people with mental wellness support during this time. And then the next slide shows that the third area, as I mentioned, was practical supports. And we're collaborating as oncology patient groups to develop an action plan to help people in 3 practical areas. The first, and really we're getting a lot of calls about this, is food delivery. And because there are many people who cannot go out or are unwilling to go out during this time because of this pandemic and the fear of infection. And so that's a basic food need that people have been clamoring for. The second is some access to travel support. Although a lot of doctor's appointments are being canceled face-to-face, and there's a lot of telehealth, and that's wonderful, there's still some situations in which people do need to see a practitioner, or they have other emergency needs. They need to get to a family member who's unwell, or they have other needs for immediate transportation, and we're hoping that we can help with that to some extent. And the third, as I mentioned earlier, is this whole issue of isolation. And we're hoping that we can work to get people access to computers if they don't have them, get them access to Wi-Fi if they can't afford it, and other forms of social media-based computer access and social isolation access, so that they don't feel so isolated during these times, both from the people they're close to and just from others in their situation. So again, this was an area that we felt needed an action plan for us to assist. So in addition to developing things ourselves, of course, the most important thing was to reach out to other community groups to see what supports they had that we could perhaps augment, and we're working on that as well. And of course, as I mentioned, we'll share a list of practical needs with collaborating healthcare providers and industry to validate that the implementation plan that we're proposing for practical supports and solutions makes sense. So those were the 3 areas. And so if we look at the next slide, this is kind of where we can start questions and answers. But before we do that, I'd like to spend a few minutes talking about what we've done to date. So we have the 3 working groups set up. And by the way, if anybody is interested in joining any of those working groups to help us develop our action plan in any of these 3 areas, we'd be most willing to have you. The first group, the knowledge exchange group, has in fact met twice, and we're very happy to say that we have the Canadian Cancer Society on that group amongst others, and they have some very rich resources in terms of knowledge exchange that we're linking to and putting on our website, and they in turn are putting a lot of our resources on their website. So that's kind of where we started. And we're really at this point just we're putting together a way of articulating the different areas of knowledge. So in other words, so we're developing a list so that when you go into this knowledge exchange hub, if what you're interested in is information about COVID-19 in general, we would have a section that's what we know to date about COVID-19. If you want to know something specific to oncology or a particular area of cancer's area, we divide things up in that way. We'd also want to divide things up geographically because different things are available in different geographies. So we're working on how to develop this hub right now in a way that is easily accessible and also helpful to people and easy to manage. We don't want to make this complicated for people. As it relates to the mental wellness group, we've also met a couple of times, and so far, and we've started to put resources in this area actually on the website, and the information about how to get to our resources are on this slide. So far, what you should see up there are the names of healthcare providers, mental health care providers, who have been validated as having the credentials that they say they have. There's at least one psychiatrist there. There are some psychologists on there who have offered services, some for no cost, some at cost. But those names are up there. But everybody whose name is going up there will be validated as being a legitimate healthcare provider of the type that they're described as. We have to be clear that we are not making any endorsements of one therapist or another therapist. We're merely making sure that these people are, in fact, the kind of therapists that they indicated that they are, and that they're validly licensed. So the other piece that we're working on in that area is how much resources we might be able to provide people individually if they need help to pay for any of these mental health services that are not covered by the government, and there are many that aren't. So we're working on a set of a test kind of what the criteria would be for us to be able to try to support people, and of course it's based on resources, and we're just starting to get some resources in from a few funders to date. So that's one thing you'll find there. The other things that you will find there are, for instance, there is a psychiatrist in Nova Scotia who's doing a 6-week healing at home empowerment series on Sunday nights. Information about that is also on that website. And there have been different teachers of yoga, Pilates, meditation who have offered to let people join their classes online for free as a donation to oncology patients. That information will be up there, as well as things that you can do at home, links to things that you can do at home, like meditation practices and yoga practices and so on. So we would certainly be interested if you have any suggestions about things that should be up on that part of the website as well, or if you have any linkages to care providers or other services that you think would be interesting for us to make people aware of, that would be wonderful, and we would certainly appreciate that very much. And as I said, we're obviously on the right track because just today the Minister of Health federally has set up also a federal website with resources. I haven't had a chance to look at it yet, but with resources to help people with mental wellness. So it's obvious that this is a profound problem in general as a result of the pandemic itself. And then when you add to it all the problems that oncology patients are having with getting treatments delayed and canceled and so on, this is a profound problem. So we're glad that we'll be able to provide some resources. We also have had an offer by some medical students who are associated with one of the oncology clinics, but who can't come into the hospitals right now, to volunteer their time to answer phones and help people with questions that they have. That doesn't mean they're going to provide treatment advice. It doesn't mean they're going to provide mental health advice, but they will be able to assist people in being directed to places that will assist them depending on the issue that they have. So I think that's really a wonderful partnership, and we're so pleased that they are offering their support. We're just working out all the details of exactly how that will work, and telephone lines and all of those sorts of things, because we're early in our development of this task force work. But we're just thrilled with that opportunity as well. And as it relates to the third group, the practical support group, we just had our third call today, and we're working out details about eligibility for access to food delivery. How would we help people with that? How will we help people with taxis and other travel that they may need? So all of the details of that are just in their infancy, but we certainly plan to be up and running, and we're just bringing a coordinator on board to help us with all of those details, hopefully in the next day or so. So these are big projects, and I have to say that we have had amazing support from a number of oncology patient groups: Lung Cancer Canada, Myeloma Canada, Save Your Skin Foundation. Certainly CNETS has been a big supporter. We've really had broad support, and the Canadian Cancer Society, Rethink Breast Cancer. It's really been a broad coalition, and it's really wonderful to see that. We've also had strong support from the medical community for the practical support that we're giving, and we're hoping that some of what we do can take some of the pressure off the healthcare system and other supporting systems, because we all know that they're really under-resourced and overworked at this point. So anything we can do to help, we're really glad to be able to do it. As I mentioned earlier, this will be based on funding. We are seeking funding from a number of sources, and we've had commitments from one funder, and there are several others that have certainly expressed an interest in helping, and we hope that they will be able to do so. So that's kind of the general idea. There's another group that is working on so we're working on sort of practical ground level support for people. There's another group that's helping with the treatment access issues, which we know are significant, and we're involved with them as well. And of course, the Canadian Cancer Society has a lot of peer-to-peer support and an amazing array of services as well. So this is it's a wonderful partnership. It's just so unfortunate that we have to come together in this way, but I really have to say that I feel that the cancer community is really working on these challenges together, collaboratively, and I'm certainly very proud to be part of that community. So with that, I'm not sure if any of you have either questions or comments, advice for us moving forward. I'd certainly be happy to have any conversations you'd like at this point.
Thanks very much, Louise. That sounds like an excellent initiative. I just want to remind people or make them aware that if they want to add questions, they can do so using the chat function on the forum, and so that should be on the right-hand side of their screens. Perhaps at this point, I'll turn it over to Rico and find out if we have any existing questions at the moment.
We don't have any chat questions yet, but I just sent a message to, oh, there's a hand up right now. There's a hand up. If you can ask the question. There's no.
So Louise, while we're checking the questions, in the interim, I just wanted to ask you, I'm actually not visually seeing your slides at the moment. So there is an actual web address at the moment that people can go to access these resources, or is this still under construction?
Well, it's open for people to take a look. At the moment, the mental wellness section is up, and we're just developing the other sections as we go. So it's under construction, but there's certainly some resources there. And if you don't see something there yet that you think you want to know, we also have you can get in touch with us at the coordinates on the screen, and we will find a way to assist you in the interim before we can get everything up and running. We don't want people to be left out just because we're in our infancy. We'll do our best to fill in, in the interim.
Mm-hmm. I'm finding that there are a lot of resources out there, and I think it's great to have so many groups coming together and having a central point for all of this information, the Q&A to direct people to, because we could be spending a lot of time on the internet, going to individual websites to look up for bits and pieces of information. So this is, a great collaboration, and I think it's a really great idea to have the information centralized.
Well, I think the other thing, that's important is that we will validate things that we, at least we will not put them up until we're sure about them. And so we'll make sure they're from credible sources, and we'll keep it up to date on an ongoing basis, so that as we learn new things and as we get more information, we'll be able to keep this. You'll know that this is an up-to-date source. You'll be getting really up-to-date information.
That's great. Rico, do you have any questions?
We'll certainly have phone lines too, that people we'll definitely have phone lines that people can call into. So this is very good.
So I have someone's hand raised, so I'm going to unmute you. Let's see. Dave, you're unmuted if you have a question. Dave?
Hello, I'm sorry, no, I don't have a question. Thank you.
Okay, no problem.
Not yet.
Okay, then, well, I guess if we don't have any questions at this point, perhaps if anybody has any questions that they think of after the fact. Sorry?
Maybe I have a question for the group, which is, if anybody would like to comment, is this an initiative that makes sense to you? Does it seem to be targeting the kinds of problems that you think either you're having or you're aware that others in the community are having, and also if you have any suggestions for us about how we might be able to operationalize it, that would be wonderful as well. So I have
a question.
Oh, go ahead.
Are you looking at providing financial support for cancer patients during the pandemic, and if so, to what degree?
So the answer is yes, we are. Our hope is that we will have enough funding to be able to assist, certainly for paying for delivery of food if people need that, and there's any payment that's required for that, for taxis or other modes of transportation that people need to get around during this time. If we're fortunate, we're hoping that we will also have some funding to help people to pay for psychological support, to pay, we'd like to be able to provide people funding for a computer, or try to get them donated a computer and donated Wi-Fi services if they need that and can't afford it during this period. We know people have lost jobs. We know people are, may not have had those services before, felt the need of them, and now do. So yes, to what extent, we don't have that worked out yet. It will be a function partly of funding, obviously, how much money we can get in, and also a function of the amount of need that's out there. And we really don't know that yet. We have had quite a few requests for assistance to get food delivered, but we haven't really had too much in the way of travel, but that might change if people know it's out there, and psychological support if people know it's out there. So I don't have numbers for you yet, but in principle, that is our hope for sure.
I have another hand up. I'm going to unmute you, Marge.
Oh, hello.
Go ahead.
Yes, thank you. I was just wondering if there are if you're going to be considering some practical strategies for people that may find there's a delay in getting their prescriptions or their medications that they need during COVID-19.
Maybe you can, like, what do you think? I'm not sure exactly what the question is.
I'm just thinking personally, I get a monthly injection, and that monthly injection is delivered to my home. And so I'm just wondering if there is going to be anything kind of set up in place to make sure that there isn't a delay in processing those medications, because I don't know that they come locally. I know different things that I've read about with some of the medications that are coming from overseas, and delays in those, and the integrity of the medication that you get.
So this task force is definitely not set up for that purpose, but those are issues that as a community, aside from this task force, we certainly need to keep an eye on. And we are part of a virtual roundtable of community groups. And I would certainly, if those issues come up and people let me know, I will make sure that virtual roundtable of community supports is aware of this, and we will do whatever we can outside of this task force to assist, because I mean, obviously we want to. It's going to be very difficult though to do. I mean, I don't want to fool anybody into thinking that there's any magic to this one. This is a very complex, difficult problem, and a lot of it we just don't control. But we will certainly do anything we can to facilitate.
If I could just add to that, we had, I've seen that we were recently contacted by a patient who was having an issue getting the supply of a particular drug that he normally does, the quantity that he normally would, and was told by the pharmacist that he was not able to access it. And he reached out to us for some assistance. And we reached out to the manufacturer of the drug to find out if there was a supply chain issue, which they confirmed that there was not. And we were able to determine that the problem was actually at the distributor level. It wasn't a shortage, but they were cutting back and kind of holding on to some of their stock just in case. And for this particular individual, it was a huge inconvenience to have to go more frequently to get that medication. So, the patient organizations are also available to, to assist in those types of things, such as CNETs. And in this case, with our assistance, the patient was able to get the supply that they needed. So, there are resources and support out there, definitely, for these types of things. Rico, did you have more questions?
Yeah, I have a sort of comment question. I think this initiative would be beneficial to coordinate our efforts in the area of need, but there is also a lot of groups out there right now trying to assist patients. So this is no easy task to coordinate efforts. Is this a realistic expectation?
Well, you're right. I mean, we're very fortunate that we have on our working groups members of a lot of different organizations. And so they're letting us know what they're able to take on and ensuring that we're filling gaps rather than overlapping with what they're doing. So I think that's a very legitimate point. The last thing we want to be doing is duplicating something that someone else is doing. We think we are not, from what we understand from the oncology patient groups that are engaged with this activity. And we also spoke with the Canadian Partnership Against Cancer, which is the federal government's funded cancer coordination group just yesterday, actually, and asked them from what they were learning through their sources whether they felt that the activities that we had decided to take on were the best activities for us to do and made sense. And they gave us very strong support for the work that we were doing and said that they felt absolutely that we were on the mark in terms of places where there were gaps or where there just wasn't enough capacity in some groups to be able to help everybody. I mean, take the example that Jackie gave. That's a lot of work for an organization, and thank goodness, you know, that organizations are able to take that on. But if they have too much overflow, we'd be glad to help out with some of that if they ask us to do it. And certainly on the practical side, I can tell you that it doesn't sound like much, but even organizing to get one person food delivered to their home can take quite a bit of time and coordination. So so far we haven't heard that, you know, that we're just taking on things that are already being taken on by others, or that there's a big overlap, that there really is a gap that no organizations seem to be able to fill by themselves. And I certainly can understand that. I mean, we're just, and many organizations are now under really big funding restrictions this year as well, because a lot of their fundraising, they can't, you know, do some of the fundraising that they normally would do. So I don't think so, but if people tell us that they don't need us to do some of these things, we certainly won't take them on. And that's really why, you know, I'm happy to hear back from you about this. But you're absolutely right. The last thing we need to do is to duplicate anybody's efforts.
I think I have another comment / question. A lot of organizations are focusing on lost revenues due to the pandemic. And with this focus on revenue generation, I'm not sure if this initiative is feasible for us right now, given the focus on finding new revenue streams during the pandemic.
So we're not expecting you to take on this. This is work that we've decided to take on as volunteer working groups. In fact, our hope is that, to the contrary, the fact that we are taking them on might give you some relief and take off some of the pressure that you're feeling as a result of loss of revenue and maybe loss of staff and perhaps volunteers and so on. So we're trying actually to fill some gaps here for you if we can. And if it turns out that that's not what we're doing, then, you know, we'll do something else with this task force.
That's all the questions I have.
Okay, well, that's great. Louise, is there anything else you wanted to say in closing before we end the webinar then?
No, just to say thank you very much for joining, and also, you know, feel free if you, when you think about this afterwards, if you have ideas for us about how we should do this work or where we should put our emphasis, or you have resources that you want us to put up on our website, then please feel free to get in touch, and we will definitely be very pleased to hear from you.
I believe that everyone will have an opportunity to complete a survey on this webinar, and I think in there there'll be lots of room for comments. So they can also, people can also provide input through that forum, and we'll make sure that you and your team get access to that, Louise.
Thank you very much.
Thank you very much for taking the time to be with us today and for sharing the information about this extremely important project. And thank you for everyone for joining us, and we hope you have a good evening.
Bye-bye.
Goodbye.